Let's just go quickly on a subject that I feel is important to relate to because it helps us in a total mindset here with what we do. And that's just a quick word about orofacial pain. I find most dentists don't treat orofacial pain because most dentists don't even recognize orofacial pain. And if they do, and you believe the literature, you know, I'm a literature nut. I've subscribed for many, many years to 14 journals, read every one of them, and just absorbed them. And it was appalling how much misinformation gets into the literature and then is repeated over and over again. Because once it's been in the 3 articles, all copying the first article, then it's dogma, you see. And so much of it is wrong. And there's good stuff in there too, don't get me wrong. But if you're going to believe what you read in the literature about orofacial pain, you're going to have the opinion that most orofacial pain is just a psychological problem caused by stress. Let me give you a real wake-up on that. Parker Mahan was probably the most brilliant neurophysiologist in the orofacial pain ever. Parker Mahan. The Orofacial Pain Center at the University of Florida was named the Parker Mahan Orofacial Pain Center. Mark Piper is, to me, without peer, as a maxillofacial surgeon who's concentrated on pain, of the orofacial pain and temporomandibular joint disorders. The 3 of us spent a great deal of time together. And I asked the question one day of both Mark and Parker. How many orofacial pain patients have you seen where a psychological factor was the primary cause of the facial pain? Parker Mahan's answer was never. I have never seen an orofacial pain patient where psychological problem was the primary cause. It may be a contributing factor. So it may make the patient less able to cope with the pain. But as the cause of the pain, no. Mark Piper, same question, same answer. Never. Never seen that. I can say the same. I've been treating orofacial pain for many, many years. And it is not a factor that the stress or psychological problems have never been the primary factor. It can be very often contributing, don't misunderstand that, but not a primary cause of the problem. But if you read the literature, you would come away with the idea, oh, you've got TMJ, you must need to get rid of your husband or something like that, you see, or you hate your mother. It isn't so. Let's understand something about orofacial pain because it relates to everything we're going to be talking about and giving you a perspective. Why is it important? Well, there's 2 perspectives on orofacial pain. The first is it's all in your head. That's the stress psychological factor. This is a good example of that kind of writing. Dysfunction usually is a consequence of the pain rather than its cause. So primary therapeutic attention should be directed at the pain. This means cover up the pain. See? So we're going to just say therapeutic attention should be directed at the pain. There's nothing wrong with doing that in combination with other things, but not the primary. So we're going to scratch that. We're going to look at the pain for what it is. Here's the definition of pain. It's an unpleasant sensory and emotional experience associated with or described in terms of actual or potential tissue damage. Please don't miss that point. Pain is a result of tissue damage somewhere. It might be tissue damage in a nerve. It might be tissue damage in a muscle. It might be tissue damage in a joint. It might be a sore tooth. If you followed the concept that you just treat the pain, you'd take an abscessed tooth and treat the pain. What's a better way to do it? Well, pain, understand this, pain is a symptom. It tells us that there is tissue damage somewhere. Now, we're going to piggyback on this from your philosophy of practice because it relates to everything you do. Pain is a symptom. It tells you that there's tissue damage somewhere. Tissue damage is a sign. Signs precede symptoms. See, when you have a symptom, you've already had the sign. Mark Piper, the surgeon, and I, we walk in the morning together. We always have a good hour or so of discussion usually on dentistry or pain or something. Or sometimes politics, we get into that too. But Mark says, you know, if you wait until there's pain, you missed seeing the signs. Because the signs precede the symptoms, and pain is a result of those signs, okay? Good diagnosticians always search for signs. When you're examining a new patient, I don't care whether they come in to get their teeth cleaned, you look for signs. Because signs do what? They precede symptoms. But there's another aspect of signs, see, and that is that it results in a better perspective. There's probably something wrong when we have pain. Let's find out what's causing the pain. That's what we should do in our diagnostic role as a dentist. And get off of this idea that all we do is plug holes in teeth. The dentist today is a physician of the masticatory system. And if we don't accept that role, who's to do it? There is no other health specialty that is trained to look at the masticatory system. They don't know occlusion. They don't know all the things that we have to know. The masticatory system is a complex system. It ought to rate putting dentistry right up near the top of one of the complex medical specialties, you see. And it's becoming that among physicians who understand the role that dentists play now in solving a lot of these problems. So, here's a principle. First, discover the source of the pain, the cause of the deformation, the reason for the dysfunction. Now, here's what we want to start doing when we look at patients. We want to start looking for signs because we recognize that a sign is going to precede symptoms, but there's another aspect that when we see the sign, we design a treatment plan to correct the cause of that problem before it gets worse, because one of the main things to understand about signs is they're always progressive. Signs of deterioration in dentistry are progressive. That's one of the reasons why dentistry is so easy to sell. Believe me, dentistry is easy to sell. If you think it's a problem selling dentistry, then all you need to do is just understand that there's a better way to do it. And I'm going to try to give you that in a short version of how do you present dentistry to your patients so they will want to do the treatment that you want to recommend. So what are the goals of complete dentistry? Optimum oral health. That's what we're trying to accomplish. That's the most achievable level of maintainable health for every related structure in the masticatory system. Now, when you go back and start looking at your patients, will you be responsible to say, okay, if they got sore muscles, that's my job, sore masticatory muscles. They got sore teeth, that's my job. They got a sore joint, that's my job. I've got to figure that out or see that somebody does. And so it's evidenced by the absence of signs. See, that's what optimum oral health is, recognizing that signs are observable. You can see signs. Symptoms the patient has to tell you about. Signs you see. But here's the other thing that's so important. Patients typically don't see the signs. That's why when we do an examination, we see excessive wear on a tooth. We see a loose tooth. We see things like even muscle pain. A patient doesn't know that they're dentally related. They don't even know. I've had dentists come up to me in these classes with their lower incisors worn almost down to the gum line and weren't even aware that their teeth were wearing. Patients they don't seem to be aware of signs, but we should be. And then what do we have to do? We have to have the patient understand what those signs are. Well, that's what we'll talk about in presenting treatment. So the first priority is to get the mouth healthy.